Thank you, Chair Kudo, regents here and scattered across the state. Today I'll just focus on one thing, and that's the COVID-19 crisis that we are all in the middle of. Last meeting, it was barely on our radar, and today it is all-consuming for everyone within the University of Hawaii system. It should go without saying that we're facing unprecedented times medically, socially, and economically, and it is incredibly dynamic. Pretty much every day we have new information, a new wrinkle, new context, new guidance. I know that the regents receive our regular email updates to the UH community, which go out on a regular basis, and some of you may also monitor our COVID-19 webpage. But I'd like to step back and maybe provide the full overview of how your administration has approached this crisis. First, the core principles that we have used. We're committed to the safety of our students and all of our employees, and to committing the semester for our students. Second, our campus facilities are necessary to our academic mission. Those that are essential remain open to our students and employees to maximize public safety and that of our employees and students. We are closing a number of public-facing services for the duration of the crisis. It's dynamic, but as examples, the Waikiki Aquarium, the Lion Arboretum, Imiloa, the Visitor Information Station, those are all closed. We have rec centers on 2 campuses. Those were closed, and that gives you an example of the tension we face. We initially wanted to keep them open for the health of our students and employees, but we decided later that that risk was too great as the situation escalated. Our libraries across our campuses are open. They are needed by our students and faculty, but we have restricted them to UH students and employees only. They're no longer open to the general public as they usually are. And this will be an ongoing program. More importantly, inside the facilities that are open, whether to students, employees, or anyone, we are making changes to both the facility setup and also practices to maximize social distancing in accord with the CDC guidelines for institutions of higher education. It's a complicated situation that touches nearly all of us in the university. Externally, we have a university point of contact for the Hawaii Emergency Management Agency, where we collaborate on a daily basis with all the state and county officials and the Department of Health. We also participate in all the regular cabinet meetings led by the governor, and typically his entire team is engaged in state level considerations. We monitor on a daily basis the information from the Centers for Disease Control and the Hawaii Department of Health, and we reach out directly with other governmental officials as needed. And then the core of our program is really about an hour phone or Zoom meeting every morning with the university officers and key staff to review current status, respond to changing conditions, and that's where we also maximize the alignment of practices among our 10 campuses, all of which are very different. We cooperate with numerous requests from state officials and other agencies to provide information about our protocols, supplies, practices, and economic impact. In brief, the things that we have changed have touched everyone. Most notably, UH instruction will be conducted online for the remainder of the semester. Full buildings or section of buildings that are unnecessary during the crisis may be closed under the authority of one of the UH officers. UH work, study, and other spaces are being modified to promote social distancing. All non-essential travel, including to neighbor islands, is now being canceled. Our residence halls are open. We've been asked about this. We have identified isolation rooms within our residence halls. We have them at UH Hilo and UH Manoa only. The isolation rooms will support self-quarantine should that be necessary. Thankfully, it has not yet been. We have at least hundreds of students for whom there is no home to go to right now. And that's why we've left our residence halls open. Traditional dining services are now being phased out and replaced with to-go, grab-and-go, or delivery food services across our UH campuses. And all public events, that is those that are not attended for students and employees, are canceled. While we had originally announced this was for 8 weeks, in accord with CDC guidelines, I'll leak something here, but today we will be announcing with great sadness that our traditional commencement ceremonies will have to be canceled this May. We are looking after the personal safety of all of our employees and our students. Anyone who is tested positive stays home until they're medically cleared. Anyone directed to self-quarantine by the Department of Health or other authority may work from home for the 14 days of the quarantine period. Anyone with a household member who has tested positive or been directed to self-quarantine may also work from home. Anyone considered vulnerable, for example, with a compromised immune system, may work from home. Anyone with a household member considered vulnerable may work from home. Anyone who returns from a location with widespread community transmission self-quarantines for 14 days. And in addition to the option of working from home, we are looking at alternative workspaces on campus if that's appropriate for the situation. And anyone who can do their work from home may do so indefinitely during their crisis upon their request or that of their supervisor. For all employees who are on campus, the workspaces and practices are being changed to promote social distancing in accord with the guidelines. These are simple principles. They cannot possibly cover all cases, and that's what we talk about each morning to stay aligned. We are really asking our employees, their supervisors and management to utilize both common sense and compassion for everyone in the workplace, both individuals being asked to stay home and their colleagues in the workplace. And these decisions get pushed up to a UH officer if necessary to resolve difficult situations. In general, decisions about employees working from home or in part can be made by supervisors with their executive management in accord with guidelines we have published. Anyone who is healthy and is asked to stay out of the workplace to mitigate workplace risks may be assigned alternate duties that can be performed from home if their job cannot be. And if they should not be in their workplace, they cannot do their duties from home. We cannot find other duties for them. We will find an appropriate leave time to keep them at home, perhaps through our leave bank or other methodology. We have distributed written guidelines and a request form on these matters that are available to all employees, supervisors, and management. So that's the kind of what we're doing, why we're doing it, and how we're doing it. Let me just close with some reflections. This has been all-consuming for pretty much all of us within the university over these last weeks. It is perhaps the greatest challenge for many of us professionally that we will face. It is harder than 9/11. It is harder than the Great Recession. It is harder than the hurricane scares, and it is harder than the flood for the disasters I've been through. It's touching everyone. It's been hard already, and it will continue to get harder as we see the impacts across our state. We will make every decision in good faith, and the next day sometimes we find that decision wasn't the best, either because we didn't have all of the information or context, and we ask your indulgence as we know that will happen given the number of decisions that we're making almost on an hourly basis. But we will get through it, and it will be over. And we will do that together by caring for each other. There are so many positive examples of how our teams are coming together. Our faculty have been amazing in figuring out how to offer the best education that they can to our students. Short notice, new tools for many of them. It's an incredibly daunting task. Our students' lives are being turned upside down. Our instructional designers, our IT support teams, are working around the clock to help our faculty and our students. Our staff, managers, administrators are keeping the trains running, custodians stepping up to disinfect, assistants dealing with requests and schedules that change by the minute, communicators trying to keep everyone informed inside, outside the university, parents and students now scattered across the country and around the world. We need to finish the semester unless the situation changes and we are directed to close by the governor. We want our students to continue their studies. Thousands will graduate, even without commencements. They will move on with their lives. Others need to stay on track so they can graduate. They need their educations to succeed as individuals, with their families, in their communities. The state needs our graduates to graduate so they can advance the state. After this crisis, we will be a very different place than we were before it. Our graduates will be the cornerstone of that new Hawaii. So mahalo to our students for taking on an unexpected challenge, to our faculty for an amazing job that they never could have expected even a month ago, to all of our employees whose commitment and hard work for this university, for our students, for each other, for the state are making it all possible. For my colleagues, it's an amazing leadership team. UH is one of the great universities in this world. We will not only survive, we will succeed, and we will come out of this better than we were before. Thank you.